Today, I am happy to introduce Dr. David Kountz, Chief Academic Officer and Vice President for Hackensack Meridian Health, a 17-hospital network in New Jersey. He's also a professor of medicine and founding dean for Hackensack Meridian School of Medicine. Additionally, Dr. Kountz is a practicing general internist at Jersey Shore University Medical Center and a certified hypertension clinician by the American Heart Association. Dr. Kuntz is a fellow Tiger graduating from Princeton University before going to medical school at the State University of New York at Buffalo. I've known and worked with Dr. Kuntz for several years, so I'm happy to have him here with us today. Welcome, David, to 5 by 5.
Richard, thanks so much for the invitation and that generous introduction. I'm one of the founding deans, but not the founding dean at our School of Medicine, but I'm looking forward to telling you a little bit more about our school during this conversation.
Oh, and it's so exciting to have a medical school associated with Hackensack Meridian Health. I have a very close relationship with Hackensack Meridian Health because I was born at Fitkin Hospital way back when. So, in our 5 by 5 interviews here, I'd like to get to know, why did you become a doctor? What made you become a doctor?
Well, I was lucky. I had a role model doctor in the family. So my dad was a doctor, and he was a big influence on bringing home every night the joy of being a doctor. His life was pretty busy, of course, but he always loved it. And so I was very fortunate to have that role model. My mom, who's still with us, was a teacher. So kind of the combination of a doctor and a teacher pointed me in the direction of academic medicine.
Oh, that's fantastic. And now you play a dual role as a physician and an administrator. How do each of these roles influence the other in your career?
One of the things when I go out and talk to high school students about a career in healthcare, especially thinking about becoming a physician, is the field is so varied. You can become a doctor and practice, and we need desperately doctors who practice every day of the week for years and years to meet the needs of our patients. But you can also be a teacher, a researcher, an administrator. And I've always liked a little bit of everything. So I still practice a little bit. I do some research. I like teaching students and sharing information that I've learned in my career. And with more and more experience working in administration. So I really consider having that I have a terrific opportunity to make a difference and a nice mix of different things every day.
There's been a significant consolidation in healthcare through mergers and acquisitions. You've been with Hackensack Meridian Health for a number of years and watched this phenomenon as it's been going on. How does this affect physicians and staff in large hospital systems like HMH?
It's a really good question. I probably would say it affects people differently. I think some physicians and staff, probably most of them, appreciate a merger. Patients often go to different hospitals, for example, and if we're all connected through our electronic information, it can make transferring information and finding a specialist easier. There's probably a small subset of doctors who, like their pure independence and don't want to be connected to any kind of hospital, small or large. So I think it spans the gamut of how people feel about it. There, I think, is a continued economic reality that merging and therefore having more resources to offer a patient is a good thing for patients. I know I've watched through the mergers we've gone through that we have even more resources that we can make available, and patients don't have to leave our area for a lot of specialized care. And I'm not sure all that would have happened without a merger.
No, and it's an amazing organization that HMH has built through hospitals and practices throughout the state of New Jersey. You're the powerhouse healthcare provider in the state right now. And you've taken it a step further. It's really awesome that you and your colleagues at HMH have done something outside the box and remarkable. You started a medical school. What factors drove that decision, and what's it doing right now? How's things going?
So the school, excuse me, the school is doing great. It's hard for me to remember. In some ways, it feels like it was just yesterday that we opened the school, and we've had six, I believe, graduating classes or so far, something like that. We're fully accredited now, and it's just it's inspiring. It's inspiring to watch the students progress from college students to graduating and being in our residency programs and our fellowships, and very soon joining our medical and dental staffs at our hospitals. One of the other, very practical reasons beyond just the joy and the importance of producing more physicians is producing physicians who can care for people in New Jersey, and uh, creating strategies for these medical students to stay at training programs within Hackensack Meridian Health. We're a private school. We're the first private medical school to open in New Jersey in about 50 years. Having said that, we still have a preference for New Jersey students. And that's because we know that someone who grew up in New Jersey is more likely to want to stay in New Jersey for their residency, fellowship, and practice. So it's also a strategy for us to repopulate our medical staffs and grow our physicians who are part of Hackensack Meridian Health.
Well, and there's been a physician shortage of providers across the board,
Yeah.
and a health system that recognizes the need for new doctors and starts their own medical school is just a fabulous idea. What innovations have you introduced at the medical school for medical education and how to train doctors in this new environment of medicine that we're working in today?
Yeah, I'm going to shortchange some of our innovations, but let me mention a couple. Uh, the first is we are one of about 25 or 30 of the 160 medical schools that offers a 3-year curriculum, meaning students will achieve their graduation requirements after 36 months. Most medical schools, it's 48 months. We give students a option to leave medical school after 3 years if they join one of our Hackensack Meridian residency programs. So that would save those students a year of tuition. And again, it's really for about 30% of our students every year choose to do this. And they obviously need to be pretty sure what they want to do with their careers. So we call it phase 3 residency. And that's one of our really unique features of our school. The other part of that is we really have a lot of individual counseling for those students. So they may want to go on and do a typical 4th year, like medical students in other schools. They might want to do a master's degree in that 4th year and then graduate after 4 years. Or they may want to do part-time research and then do some hospital rotations in that 4th year to prepare them for maybe a very competitive specialty that requires a lot of research to be considered a strong candidate. So we give students a lot of individual flexibility. The other feature that comes to mind I wanted to mention is called our human dimension
I'm
course.
glad you mentioned it because I was going to ask you.
Absolutely. And you know a lot about it, and thank you and your organization for being part of it. We believe that the best way today to train future physicians is to make sure they understand the community and the home context of health. So beginning in orientation in July, throughout their first throughout all years of medical school, we have students in a course that includes outreach and working with community partners. We ultimately will pair students to a community member, someone who may be a patient in one of our practices. And of course, they're students, so they can't provide medical care, but they can provide general health information. And we have the students work with these individuals or their families on a SMART goal. A goal might be that maybe an elderly person who doesn't know how to access their doctor's online portal to make appointments or review information. So students are very facile with an iPad. So we have the students identify a project with we call them Voices Program members or VP. And they come back, they meet with small group preceptors like myself. And it's just a fantastic, I think, an innovative part of our curriculum. And we all found that these students are very comfortable and very prepared to interact with patients in the hospital, and they are just comfortable talking about the importance of the home environment. So we think it's a wonderful innovation. We're very proud of it, and
I
much
love
more
it.
to come. Yeah.
And I know Dr. Ricchetti, and they are so dedicated to bringing this idea of breaking down an academic wall for doctors learning and putting it in the community where they can actually interact with the patients in their homes, in their towns, and understand the socioeconomic worlds that they come from, the access to care, their understanding of medicine. I think it's a great idea. I'm really happy that you've done that. Is there a success story that makes you proud here?
There is one immediately comes to mind. So we have the students work on what's called a capstone project, just like many undergrads work on a capstone project. And one of our students identified that, or a pair of students, that their patient couldn't easily access their healthcare provider because of uh, where they lived in a particular town. And the students then did an overlay of the New Jersey Transit bus routes. And they did some other work looking at census information. And because we are also teaching them about social determinants of health and the importance of access to care, they actually were in touch with New Jersey Transit. And as a result of their advocacy, New Jersey Transit changed the route. And as a
Wow.
result of that, their patient could go to a local corner, catch a bus, and make it to their doctor's office.
Oh, that's a fantastic story. And that's the kind of thing of medicine in the community that's so necessary these days. Hospitals can't accept people as inpatients. It has to be done in an ambulatory setting. And that care and providing care, giving people access to care is wonderful. What's the biggest challenge you're facing today?
At the school or just in
At the
general?
school, for these types of programs.
Um, I think that we have a very strong community outreach team, and I wouldn't say it's a challenge. It's kind of a reality of life that patients who are part of our program sometimes drop out, sometimes become too sick to participate. Students will start to create a relationship, and for these reasons and others, people drop out of the program. And so now we're at our full complement of 165 students per year. And so we have multiple years of students in this program. So it's really dealing with literally hundreds of community members who our community outreach team is staying in touch with and in educating about the program. So every once in a while, a person in the program will drop out, and we'll need to find a replacement. The students will need to kind of start getting to know a new patient. So it's not an insurmountable challenge, but I think it's part of the reality of dealing with people, any of us who are
Yeah,
in a
you
program
have
that
to be
lasts 10
flexible in
years.
dealing with people's lives. You just don't understand everything
Absolutely.
going through, especially if
And
they're,
it's actually a good lesson learned for the students,
yeah,
because this is what your life as a practitioner is going to be. You're going
exactly.
to be having new patients in your practice because they just moved and they were looking for a new doctor. So,
Right. You know, and let's take that question a little bit further. What's your biggest challenge in providing healthcare services once they do become doctors, and how you're dealing with the changes in insurance and government regulations, et cetera, and how you're dealing with that and overcoming some challenges there.
well, again, I think it takes advocacy to ensure that our legislators understand our priorities and can help make the case, whether it's for funding or to expand access. Clearly, although the Affordable Care Act has been an incredible benefit, it's also, patients are still underinsured. A percentage are still uninsured, and that can be challenging. I think there are still barriers that some patients feel by going to a doctor, by going to a hospital. There may be historical reasons why they have some anxiety. And so teaching our students and young physicians, in fact, our older physicians like me, reminding them that there are these barriers that many of our patients feel, and to help come up with ways to overcome those barriers is really important.
That's good. Thanks. Um, you know, Innovation in medicine is something that LeagueMed is focused on, and bringing together a community of physicians, healthcare administrators, researchers who understand technology, and presenting them with ideas for innovative companies, and looking for finance opportunities for these innovative companies. As the ecosystem, the healthcare research ecosystem is evolving right now, the grant systems are evolving right now. How do you see emerging innovation? Because there's some coming out of Hackensack Meridian Health. You have a technology transfer group. You've got a whole ecosystem of research within the walls of HMH. How do you see changes in the innovative development of medtech companies, and how they move from discovery through development into commercialization? How does Hackensack Meridian as an institution deal with this environment right now?
So you're correct. A part of our organization, a very small part, does deal with innovation, but it's an important part, and it's a lot of it is around public-private partnerships and partnering with companies. We don't have the universal expertise, but we can provide a platform to work with partners on new technologies, on new approaches to care. There's I can immediately think about a couple of examples of where we need and we're seeing innovation. One is in telemedicine. Not only do we have areas of physician shortage, we have areas of nursing shortage, and so at some of our sites we're not only having telemedicine where there might be a specialist who's in a distant location, and we work with that individual to help with quick diagnosis and getting treatment started. We are piloting that in nursing as well, having remote nurses in some locations. The whole area of artificial intelligence and how it's going to interact with healthcare. One of the things we worry about, for example, is physician burnout. So could artificial intelligence help us with some of the routine tasks that physicians and other healthcare providers are responsible for every day, to maybe reduce that burden so they can spend more time at the bedside and less time with administrative responsibilities? So that doesn't necessarily touch research, but even outside of research, there are, I think, lots of opportunities to see and test potential innovative ideas.
No, I think that's great. We're working with companies that are looking for funding, and I've got one company I've been talking to. It's an ambient scribe, which would free doctors from having to go through all the notes manually and type in their notes on the EHR. So that's kind of interesting. We're working with a company that has a digital avatar for care coordination. So you talked about your nurses and being able to do care coordination to people who are difficult to manage, if you will, have chronic conditions. And I know that nurses have to go back to a house 3-4 times because they didn't answer, or they didn't follow direction, or they need help, and minimizing those trips to home would be very valuable for them. So I appreciate what you were saying there. We have a few minutes left, so I'm going to go to our 5 questions in 5 minutes. You've been very concise in your answers today.
Okay.
It's been good. I've had some guests on that have spoken for 10 minutes on one question.
Still on the first question.
I think we could probably get through these, and I'm going to repeat them a couple of them for sure. To get the quick 5 minutes and five questions here. So back to your dual role as a physician and administrator, how do these roles influence the other, and what are the challenges associated with being that dual career person?
I don't think I would be effective as an administrator if I was not still a practicing physician, or I wouldn't be as effective. I think it's really important to kind of not stray too far afield. At least this is just for me, and I'm grateful that I still have time to practice medicine a little bit and be side by side with my colleagues, and really still understand what's happening in the clinical environment. And that makes me, I think, more credible as an administrator.
Let's talk about the consolidation in healthcare a little bit. HMH is buying practices. What does it mean to a private practice physician to go from being an employer to being an employee? And how is that affecting them?
I think for many private practice physicians, it's the opportunity to have the support of a very large, very stable organization. There are strategies that allow for the staff to be hired by the organization. There, there can be a degree of having a bigger flow of patients because it's a big organization that's very well known to the community. So I think it's a way to perhaps generate some practice security. There may also be some lifestyle benefits by having the support of a large organization, and not necessarily having to worry about funds flow when you take a week of vacation. So I think, again, not for everybody, but there is I think a national trend for many traditional private practitioners to more and more consider employment or other relationships.
Yeah, thanks. In regard to the medical school, you started a medical school at Hackensack Meridian Health. This is an innovation that I've seen, and I haven't seen very many other places where a healthcare system starts their own medical school to feed the employment opportunities to the organization. What was the driving factor in starting a medical school at HMH? What were the decision-making processes associated with that?
So I think it was a lot of very smart, forward-thinking leadership by our CEO to kind of anticipate this worsening physician shortage. The idea that innovation is such a big part of HMH, and that a medical school, almost by definition, advances innovation, advances ideas. I think that it was the right time. I mean, we look at models like a medical school associated with Mount Sinai, a medical school associated with the Mayo Clinic, a medical school associated with Kaiser Permanente. These are all large health systems that have successfully developed medical schools, and no reason for us to not believe that we couldn't be similar to those organizations. I think if you were to ask me, what do I see in the next 5 years? We, of course, need to focus early in the life cycle of a medical school on the student experience to continue to get the full accreditation by all the accrediting bodies. We're now looking at things like creating an MD PhD program, which will be a big lift. So it's probably not right around the corner, but within the next 5 to 7 years, I think that'll be the kind of another innovation to not only produce doctors who are going to be clinicians, but doctors who will be physician scientists.
Oh, that's fantastic. I didn't know that. And that leads to new innovation. If you've got physician researchers, how do you think you can address the new innovation environment that we're moving into right now as a medical school and as a healthcare system? How will you develop innovation?
I think a lot of that comes from our health system. We have, as I mentioned, a unit that focuses on innovation. One of the things I love is that we are always out there in our hospitals and in our practices uh, looking for innovative ideas from our staff. And we believe that sometimes the best innovation comes from our frontline
Yep.
team members who see a problem and can help identify a solution. So we have terrific programs where we incentivize our frontline team members, and that can include a medical student or a doctor in training,
Mm-hmm.
to come up with an innovative idea that will make it through our system and can be supported. And then again, I mentioned that last year of our medical school where there's a lot of flexibility, there's the opportunity for a medical student to spend all or part of that year working with the innovation team to develop new technology or other types of innovation. So it's not a separate part of our organization. It's very much things that our nurses are aware of, our doctors are aware of, and our medical students can have an opportunity to participate.
Okay. Now, LeagueMed's been set up to build this community and foster innovation and to connect people, um, not just for finance, but for leadership and advisory, because doctors can help emerging med tech companies understand what their needs are. Just like you said, the frontline people are the drivers of innovation, and they're the ones that'll be the customers for these med tech companies coming out of some other um, product development system, if you will. Um, what do you think about this idea that LeagueMed has come up with to link practicing physicians who understand technology with emerging med tech companies who need money and pairing them through a community of investors?
Yeah. Sounds like a wonderful opportunity. I think it's very easy to be caught in your own silo and not recognize what opportunities or potential partners are out there. So by bringing together, these different worlds, hopefully it will spur an innovation and partnerships and collaboration.
Oh, that's great, David, because we're trying to break down the walls between academia,
Mhm.
commercial world, and finance, which is another world that really is essential to this whole innovative ecosystem. But we're bringing it in here, and we're really excited about it, and we're really happy to have had here today. Great job on our 5 questions in 5 minutes,
Yeah.
and it's always wonderful to talk to you. So thanks so much for your time today, and we'll
Thank you.
see
I
you
look
soon.
forward to seeing you soon, Rich.